forward. So, yeah. Welcome to the Conscious Giver podcast. I'm Tysis Jackson, your Conscious Giver in Chief. This season, we'll be highlighting the Conscious Giving Guide. And this is our third annual giving guide. I'm so excited about the work that we're doing and the small changes that we're making. If you've looked at the guide over the last 2 years, you'll see that we constantly are keeping things, I was going to say fresh, but it's not about keeping it fresh, but just being responsive to needs. And this year, I had the experience of being a conscious giver every single day when I was supporting my mom and caregiving for her with her pancreatic cancer stage 4 diagnosis. Unfortunately, my mother passed away on September 11th, but it really ignited something in me from that experience. One is that I always thought of myself, I'm a conscious giver. I'm your conscious giver in chief. But the difference of being a conscious giver in terms of providing the care for my mom was really transformational. And so this theme this year, being a conscious giver every single day, is something out of personal experience. And then doubly, our twofold theme is about health disparities and rural health. And I had that experience of my mother being in Georgia, and there was a lot of experiences about that. And if you want to learn more about the health disparities, Dr. Christopher King, we talked about that in our podcast. But today we're going to really hone in on rural health. As someone who has always lived in mid-sized cities, now I live in Washington, D.C., an urban center, I really did not understand the challenges. I know that with some of my professional work, I often saw parallels between rural health and urban health in terms of some of the disparities. But I still didn't understand until I went to go work with my mom and her caregiving and understanding what it's like to have a couple of family practices for a whole county, understanding driving to just do one test, and you have to drive 90 minutes, and that doesn't include in case you hit traffic. There are so many different pieces that are there. So I'm so happy to have a wonderful individual who will kind of share her experience as a provider in rural America, and specifically in West Virginia. So today I'd like to welcome Dr. Traci Acklin to the Conscious Giver podcast. Traci, I actually do this introduction part, but one of the things we forgot, because we know each other from the American Academy of Pediatrics, is that I was like, oh, there's a whole intro I need to have for you. But I'm like, so I'm going to tell you what I know about Traci first, Dr. Acklin first, is she served while I was executive director of the DC chapter. She was vice president and then president of the West Virginia chapter of the American Academy of Pediatrics. And a couple of things I knew really well, besides the fact that I always wanted to go shopping with her as we on our trips. We never quite made it to shopping, but she's definitely a passionate pediatrician, cares about the health and wellness of children. And one of the things that I love most about pediatricians is the fact that they're such an extension of themselves. It's not about the professional work as well. And that's one of the reasons why I think she's the perfect person to talk to about rural health. She served as, and she'll talk about it a little bit more, one of the only pediatricians in a tri-county area. And she's so dedicated to children's health, but children's health in West Virginia. And so it's really with great pleasure to have you here today to talk
Thank you for having me.
to talk about the unique experience of rural health. Now, I do want to say up front that you just have transitioned from West Virginia, but how long did you practice in West Virginia?
So I practiced for 19 years, but I lived there my entire life. So I had actually gone back to my hometown to practice those 19 years. And that was my only job out of residency. So I have actually recently moved to Tacoma, Washington. We did a big move cross country with the kids just a year and a half ago. So I'm actually now working in a tribal clinic. So.
Oh, wow. That's awesome. So I kind of want to hone in, because oftentimes we say, oh, we want to go away from home. We want a new experience. We want to go someplace else. So what made you want to go back home to serve in your community?
Well, I would like to say that it was totally meaningful, but it was kind of by accident that I had been in medical school at West Virginia University back in the 90s. And I went back home to visit, and we had gone to the capital city, and we were at the farmer's market. And I ran into a administrator from the local hospital that I grew up. Actually, I used to hang out there and intern there before I went to medical school, just to hang with the doctors and get them to write me a letter for my applications. And she said, we really need a pediatrician. We'd love to have you back. Why don't you sit down and talk to us? And I kind of thought, I'll go and do it, because she was my neighbor all these years, but at the same token, that really wasn't my goal. And I sat down with them, and really what it came down to was loan repayment, to be totally honest, to begin with. It was a good deal. They were good to me. They helped me through residency with a stipend. They were giving money. I actually participated with the recruitment and retention, the rural recruitment and retention program in the state, so that the hospital would give funds and it would be matched by this program for 4 years. And really that took care of my medical school expenses. And it just seemed like financially the smart thing to do, while I would be giving back to my community. So that's honestly how that happened. Now, how I stayed there 19 years is another story.
Well, we can get it. Yeah, we can definitely get that. But I'm glad you was really transparent and shared that, because a lot of people, I worked with, amazing physician, Dr. Wright, and he talked about a loan repayment program that he did that allowed him to come to DC and work in, and work in a very urban community. And at a time where, he was in DC, and there was, not the hospital system that it has now. They were in the emergency room dealing with gunshot wounds. It wasn't easy. And so that is really, so I really love that you paint that picture. So is that program still around?
I believe that it is, but don't quote me. I know that about 10 years ago it was, and I will say I used to get yearly updates from them that I don't get anymore. I don't know if they just assumed I was staying because they wanted to, I guess, over the long haul, see how many people actually committed to staying in the state long term after that as a success. But I have not heard anything in a while. I know that, and I just haven't been around anyone who's talked about it. So I'm not.
Did you have any other colleagues that did a similar program?
Not that I know of. I knew that there were a couple of people that I did residency with that went to rural areas in Kentucky. And I assume similar programs were in play. And in total honesty, I remember those of us who went to rural areas, most of the time, it was a community that was in dire need and was in a couple of years there and then see where things go. And so I know that there were others who were enticed by those type of programs.
Yeah. And I asked that question because I do remember him saying the program went away, and that sometimes those are like little pieces, like government programs that, people say, oh, we'll just nix that out through the budget cut. And they don't realize the impact that it has on them, on a community. So, but we see the impact of the great work it has on the community. Yes. Could you share with me, your West Virginia community, like what did it look like, and just in terms of just the healthcare resources that were there?
Well, I could say from just a community standpoint, what it looked like when I grew up and what it looked like when I left last year are two totally different things. And I think that that's what most of rural America is seeing right now, you know, a large part of that due to the opiate crisis. So when I grew up there, you know, I was lucky enough to come from a house with college educated parents. My grandmother had a master's degree in education. We always knew we were going to college. I grew up in a tiny town that was about 10 miles, 8 miles from actually the town that I practiced in, Montgomery, West Virginia, and the college was there that I went to. And all the professors lived in this town. So we were all kids of professors, and it was very educated. Now, none of the other towns around us had that, but I grew up in a bubble, a little ignorant of what was really happening with my classmates and how they grew up in the poverty that they did. Certainly, even in medical school, I remember you know, going 3 hours north in Morgantown, West Virginia, and it was a whole different world. And they talked about, you know, that they would send us all out to these rural locations because they were always encouraging us to practice in these local areas. And they would place us there even almost 30 years ago so that we made contacts and kind of got to see and appreciate what goes on. And they would tell us, you know, you're going to go to Southern West Virginia, they're not going to have cars or you know, they don't have transportation, they don't have phones. And I thought, this is ridiculous. I mean, that is not the right picture. I was offended. And then I went back and practiced, and it was totally the picture. I mean, that is the situation, you know, and now 20 years later, the opiate crisis has come into play. And so you have that disaster. You also have further economic disaster. So even the college that I went to for undergrad is gone in the town that I practice. I have yet to hear of a college leaving a town, but even the college picked up and left and moved to a larger city in the state. Car dealerships are gone, restaurants are gone. There's very little left. How the hospital has stayed afloat, I have to credit the CEO. It's a 25-bed critical access hospital. And, you know, somehow it has stayed alive, and I'll give her credit for that.
Right.
It is about 40 miles from the capital city of West Virginia through the mountains, and certainly not in the deepest parts of the kind of hollers of West Virginia, but is an example.
Yeah. Yeah. Well, I think I might have told you my stepdad was from West Virginia, and in the 80s I actually went to West Virginia, a little red jacket twice. And then I used to think it was close to Huntington, but then I learned that everyone says they're close to like this city that they're really not close to.
Yes, yes.
Because I was like, one day I looked at the map, I was like, wow, we're really not close to Huntington. Like they're like, no. But you know, it was the Black town, and I'll never forget that there were still outhouses. And I was so shook by that, because I was like, Laura Ingalls, I was like, why are there still outhouses? You know, they had running water and bathrooms in their house, but it still was there. And then we used to go out, I'll never forget this. We went out back and picked coal picked out coal. I was like, there is coal just laying around. Like, what the heck is this? And I mean, I was pretty young, but I do remember that and just was like, oh my gosh, this is a whole different world than what I was used to.
It's a different world.
Yeah. So it really is, that's, you know, as you describe your experience growing up in the university, just picking up and leaving and other places. I actually went to just my one last, maybe not my last West Virginia story, but I actually went to, oh gosh, when I worked at Virginia Tech. Oh gosh, where is it's? I don't want to say it's Blue. Bloomfield. Yes, I went to Bluefield, and I will never forget feeling like I was in a ghost town.
Mhm.
And this is
because that would be a big town.
Yes, that was it. Yeah.
That's
and I
big
remember
town.
just seeing like in the city, like just blocks of just nothing there. And I was like, I thought this was pretty big. There's, West Virginia State is here. And I don't know how much has changed, but it was really, it really felt like it felt like a little bit of a ghost town. So I think that you've done a great piece of describing what what was happening in the community, and I want to delve in that a little bit more in a bit, but I just want to get another piece of just in terms of your practice. Pediatricians, people forget it's a specialty. What that looked like in terms of you actually being like one of the only pediatricians, and just what was some of the common health pieces that you saw from the community?
So when I first joined the hospital, so I was actually an employee of the hospital, and they basically had a clinic set up there for me. When I originally came, there had been a couple of pediatricians who were kind of near retirement and not really seeing that many people. And within a year or two, one left, and the other one had to practice a couple more years. But as my practice grew, I was quickly the only one there. I was also the only one in the closest two counties, and even extended, West Virginia is not just divided by counties necessarily, but by mountains, and so where kind of went into three counties that I was the only pediatrician in. And so it was a busy practice. I was the only one. I did end up getting a physician's assistant, and over the course of the 19 years that I was there, I went through 3 of them, but they all stayed a long time. And I had great experience with the physician's assistants that I had there, and they were very good quality. And they were great to work with. However, like if I were to leave town, I generally still did phone calls from a distance, and then would, if there was an emergency, maybe one of the family practitioners would take over for that part. But that went on for the 19 years. There were many years that I took call by myself. When I delivered my first baby, right after I had delivered, I actually took a phone call from a patient when I was still in the bed.
Oh my God.
I had 2 weeks of maternity leave and then had to go back part-time just because somebody's got to be there, Yeah. It just, in rural areas, when you're the only one, it is what it is. I'm constantly hit by locums tenens groups where they're always looking for small hospitals that need coverage. And that's why, you don't get to escape, So yeah. As the practice grew and I had a little more coverage with the PAs and felt more comfortable, then I was allowed to take on the role with the president of the AAP, because that took me out of my practice a good amount. But yeah, it's a we have frozen.
Yeah, I'm sorry. We're having a bit of technical difficulty, and I think it might be at my end. So when you're watching this, you just have to bear with us. This is one of the challenges that we have. It doesn't matter you're in rural America, urban America. Nope. It is going to happen. It feels so overwhelming. So like as a young professional for you, because oftentimes, just working with pediatricians, when you're early in your career, you're really leaning on those with more experience. And so you really had to just sort of figure things out a lot of times on your own.
Yeah. And, I will say when I went to do my residency, I had initially planned to stay at the larger university program and then switched gears when I signed with Montgomery, the hospital that I was at, to actually do the same. It was with the same university base, but a more community hospital that was closer to where I was practicing. And that was invaluable because I had all of those contacts that were like 40, 45 minutes away that sometimes I remember going in and seeing a patient with a rash and thinking, oh my gosh, this is like meningococcemia and I've never even seen it, but it's this petechial rash and it's scary, but this kid looks good. But you need to run it past. Sometimes if you just say it to someone else, you can kind of clear your thoughts and make a decision. But when you're by yourself, constantly in the books, trying to make myself feel comfortable, just constantly. But I was able to have those connections at that more local, smaller community hospital, but it did have a number of pediatric specialties and subspecialties that I could run things past. And thank goodness I knew them. So which is one of the things with rural medicine that I think is invaluable, is having kind of a partner. And I think had I gone from my medical school residency program into a totally different area, you can always call someone, but knowing that there's a physician that you're like, okay, at least in an hour or so, I could figure out, or a couple hours, figure out how to get them to them for an opinion. You know what I mean? That there's someone on the phone, but I could do that. That's invaluable to have. And that doing the residency close to there made that possible. So I feel for the physicians that are truly on their own.
So I know you mentioned that you were affiliated with the hospital, and that was the 25-bed Montgomery Hospital, 25-bed hospital. Okay. And so was that a standalone hospital, or was it affiliated with any larger institution?
It's a standalone hospital that's never been affiliated with other institution now. And in a lot of these rural areas of the country, they have partners. Ours was called Partners in Health. And so the larger facility, Charleston Area Medical Center in Charleston, West Virginia, was a partner, so that if they needed beds or something, you had a special line to call and they could take your kind of overflow, or, you had someone to help in certain circumstances. So that, especially in adult medicine, is important. So that was always a part of it, but there was no further affiliation. That's not a financial affiliation, and it's not it's not that we were part of them.
Wow. I'm just, because I'm actually flabbergasted right now, just, having worked at a hospital and understanding that there's this magic number. I wasn't in the administration, right? So I was fundraising, but there's this magic number that you have where you can actually, you keep the beds full, it keeps you going. Oftentimes, there's this new story out about St. Jude's Hospital from ProPublica. And I was like, St. Jude's is $1 billion annual operation. It blew my mind, because it blew my mind that it was $1 billion a year. I knew that it was a lot of money, but I was like, $1 billion? Oh my gosh. And
that
so,
little hospital was not.
Exactly. That's where there's a lot of, people talk about hospitals like, oh, they make all this money and they charge us. But that is only a very narrow few, the John Hopkins of the world, those Mayos. There's very few that actually can that actually are like turning profits, and that most of, particularly rural America, they are just hanging on. And 25 beds, like you literally have to be full like every single day to even.
And they're not. There are times where they have 6 beds full, and that's always has been going on for years. It's the critical access, I think, gave them a slightly higher reimbursement. And I'm not going to get into the intricacies of it, but that's how they have helped some of these smaller hospitals across the country. But it is living month to month, has always been surviving month to month. I really had feelers out numerous times about when it looked like the end was coming. And, these hospitals barely can make ends meet. So they have to be creative.
Yeah.
That comes a lot of times in staffing, and staffing is its own struggle as well. But lots of.
If you have 6 beds, full daily, it's really hard to.
Well, and you think about what the staff makes. I know my staff in my office there, it was paid by the hospital. Their pay was so low compared to the city that was close, but then you'd have driving expenses. And then when I hear what the same type of staff with the same so all the staff is paid at a lower rate. And trying to find staff is difficult.
Yeah, absolutely. Oh my gosh. I'm like, oh, so I'm trying to not go to this topic, but I need to get to a happy topic for for 1 second. Because before I start to go into some of the health disparities in your community, but I would love for you just to reflect a little bit. I'm jumping to this because I need a happiness, because I'm like, oh my gosh. And to be honest, this is why I'm talking about this, because it's so overwhelming in terms of, this is not an easy fix. It's, as we talked about with Dr. King, there is not one finger that we're pointing. It's the hospitals, it's this person. It's not, it's a whole system. And, thinking about the ability of that hospital being in the community, and your affiliation, what was some of the biggest impacts that you saw about you being there and the work that you were doing that kept you there for 19 years?
Well, I would say, first of all, you stay there 4 years and now you've made connections. So there is something to be in the country doc. It is, you feel a part of these families' lives. And maybe I just made myself feel that way, but they definitely were a part of mine. And not to mention, it was also my hometown. So I don't think I would have ever kept contact with a lot of my high school friends that I was able to for years, that were valuable friendships, and take care of their kids. It was always an honor to be able to do that they thought enough of me to bring their kids to me. And I think maybe there's a little, with a pediatrician all the time, but especially in a rural area with a low educational level and very few people that make it to medical school, there's also maybe a little play to your ego that maybe you might be the person that gets a little girl to, get out of high school, go to undergrad, and then go to medical school. And so always that too, that I always loved. And there's, I came here, and it's been a tough transition to go into a different practice in a year and a half, into a different culture too, that I'm not really, I'm an outsider to, and try to break down those barriers when I have been so spoiled for 19 years, where I basically was part of the raising of a generation there. And I knew their medical history, and it was so easy to walk into a room and automatically know what medicines they were on and what specialists they saw, or, what was happening with the extended family. It was very nice. And that's what keeps you there. Every year I would think, oh, I'm going to go. I probably got to get my kids to an area that there's more opportunity, and, but it was a good situation, and they were good to me. The hospital was always good to me. And so they let me practice kind of the way that I wanted to practice. So they didn't nitpick which vaccines I wanted to give. I felt like I got to practice like I would in a university setting and do what was right. And they allowed that. They gave me that freedom, and I would not have had that everywhere. I do not have that right now. And it's not bad, but there's a
no, it's definitely, no, it's definitely a big, when people talk about, there's like this whole movement of people wanting to, be entrepreneurs, and they're like, I worked for this big corporation and I had ideas and I wanted to do something and I couldn't do it because it was a big bureaucracy, you know what I mean? And so I left and did my own thing. So, I mean, I definitely think that like that is so much value into being able to kind of pull in and make those decisions. And
I had a lot of harebrained ideas. There were things that worked, things didn't, but I'd be like, a playground for the local school. We're doing a walk, a 5K, and 20 people came. It didn't really help, but it would get kids exercising. It was a good thought, but it didn't work. But I did do a health fair every year that I had wanted, and I wanted it to be a purposeful health fair. I did not want it to be a bunch of booths that were just informational. And so we set up health screens, and we had dentists doing health screens and orthodontists checking their teeth for alignment issues. And we had respiratory doing asthma screens. And we went through this every year. We did it. I think when I left, it was 17 years old and had grown to 90 some vendors. It was of the area, and I was super proud of it. But again, maybe a harebrained idea that the hospital totally went for, and they would basically shut this place down for a day and have come and help set up, and all the departments were encouraged to help. And, those were all of the things that were wonderful to be able to do. And in a small area, it's easy to make connections, to know people, teachers, leaders within the community, so that you can do those things, which brings up the American Academy of Pediatrics, which was probably my biggest boost in collaboration. So having, I had always been a member, but I didn't become really involved. They had given me like an award at one point, like in 2011, which may be how they suck you in. But and so then I got involved in leadership. And when I became involved in leadership, then I got to make more connections, and especially at a university level. So the big medical school that I went to, that I kind of had lost connections with, that they came back. And so that was good for the practice and good for my patients, that I, if I had a question, I could quickly make a contact and get a patient, to them the next day, that also to make kind of collaborations with studies, quality improvement initiatives within the practice. I worked with a person within the state who's just a force of nature, who's amazing with the kind of obesity epidemic within West Virginia. And we set up a farmer's market in the lobby, and we gave certain people who decided to commit to the 5210 program, coming back every month, doing health screens so that we could encourage healthy nutrition and exercise. And then we'd give them money each month that they came, or gift certificate that they use at that farmer's market, while we tracked weight. And so we did a lot of programs like that really came from knowing the other people who were trying to make a difference in the community, but also through the American Academy of Pediatrics, that gave me a lot of those connections, and that helped support and kind of gave a framework. When you're in a busy practice, the last thing you need to do is reinvent the wheel. You don't have a lot of time to sit down. So you have to be, I felt like I was always an idea person, but thank God for my staff who would make things happen.
They were the executors.
He's got another crazy idea. This is what we have to do. And so and I always went along with it. But yeah, so that the American Academy of Pediatrics was a huge player in helping support me in my rural practice. So.
Oh, wow. And it's so nice that you, gave back and also to other pediatricians in the state by serving as the vice president and then on to the president of the chapter.
It was a wonderful opportunity. And, the academy, it enlightens you into not just what's going on in your area, but what's going on with children's health across the country and how you can impact that. And so my time with them was valuable. I miss it because now I'm in another state. So I'm starting over and during COVID. So I haven't met really any other pediatricians here except the one I'm taking my son to. So, that's it. So yeah, that's it. I have one other pediatrician that I work with. But yeah, so I miss those connections. So
yeah. But you know what though? Well, you're in they have a really strong chapter in Washington State. So that we can talk about that later. But when we think about like conscious giving, ways that people can, people do conscious giving through time, talent, and treasure. And so we've actually, when I'm listening to you, I'm listening to the ways that you've really done your conscious giving and that facilitated through your expertise, medical expertise. But one of the big things that I really want people to walk away from is to understand how they can make a personal impact. If I'm not a physician, I'm not a pediatrician, I don't live in a rural community, but I grew up in a rural community. I'm really interested. Like, I really want people to walk away and just to be able to not only learn, but to actually have action behind them. And so there's not a big magic wand that I'm asking for, but, I don't know if it's drawing on some of the work that you did with AAP, but what are some ways that you saw that people really made an impact on children's health, overall health in West Virginia, and they were just regular, everyday people?
Well, I think people, one of the biggest issues when you come down to it, and when we started talking about doing this and you start thinking about what's the big thing that needs to change to improve the health in that area. I think we can get specific about the healthcare. I think it's education. I think the education system is just struggling there to keep the kids safe and fed and make sure that they're okay from that standpoint, that the education, all these teachers are struggling and trying to obviously do that as well. But it becomes harder and harder with kids who are struggling in homes with a high degree of stress and adverse childhood experiences. And so they all get shuttled into these kindergarten programs that every year get a little more difficult for teachers to deal with. And they don't have resources to help them support these kids. And so I feel like when it all comes down to it, that I would probably say like education, which I know doesn't sound like it's directly involved with the healthcare, but it is, I mean, I can't tell you as the only pediatrician and no psychiatrist in those counties, how many ADHD kids I was involved with. And, as a provider, you take a hard look at yourself and say, what do I do? But I had them evaluated by other people. I did not want to be the diagnoser and the medicator for all of these kids. But, there's a fine line between not being able to pay attention and being exposed, in utero to drugs and alcohol, and then in a home with huge stresses and not being able to pay attention at school and not knowing how to deal as a child with your anxiety or your depression or your anger. And so it all gets lumped. And so, again, that's the direct correlation. So I even at one point was working with the local principal and a psychologist, but again, she was like for the county. there was one for all the schools, or maybe two. But And so I feel like we need to dive into that, to the mental health crisis that's in those areas, so that the mental health / educational system. So you get into education systems, which I would love to see more after school support, after school education programs, tutoring programs. Anybody can volunteer and tutor, right? Those type of things I feel like would make a huge impact on the area. And then us just trying to get more mental health services in those areas. Like I say, there was no psychiatrist, right?
Yeah.
So doing the anxiety and the depression and the ADHD. And when you're a pediatric resident, you don't necessarily get prepared for it. And then you get thrown out and you're like, oh, I'm the one, they don't know something. They can't drive. They don't have the transportation, the 50 miles, those kind of things. And so I feel like just a huge lack of mental health services in rural areas, and giving to programs that encourage or that reach out to those areas would be invaluable. And I think that's what it comes down to, and would help the healthcare system as well.
Well, I know this is a trend. So I'll definitely have to kind of place you when we release the podcast episodes, make sure that I'll encourage people to listen to Dr. King and you, because that was actually what he had said as well, was education. And the context that you framed it in, it literally makes so much sense, because when I heard you talking about your partners, they were your partners, was the schools, the teachers, the principal, in the work that you were doing, the pediatrician's office, and that is so foreign. Like, that's a foreign concept to a lot of people. Like, what? That doesn't make sense. That doesn't make sense. But you framed it really well, in terms of what that means. So this year for the Conscious Giving Guide, we are supporting asking people to actually support 3 organizations. And we have another Conscious Giving Guide guest who has experience in a personal story in a rural hospital in West Virginia. And so I knew that I really wanted to do something in West Virginia, to have an organization that's doing great work, and to honor the work that you've done, and also for my other guest and her mother, and and values. And so this year people can support Think Big, West Virginia. And so that I was looking for organizations, digging around, and that was one that was referred to me. So, and I was like, okay, this is good. I mean, this is the type of organization that conscious givers should support. And so I wanted to talk to you. I wanted you to share a little bit about if there's any, if there's some experience you have there, but also with that organization, but if there's any others that you think are doing great work to help with health outcomes in West Virginia, and even unique to your county. I would love for that opportunity for people to be able to learn, because we all come with different passions and different areas of where we really want to do our conscious giving, right? And our idea with conscious giving is to be intentional to make impact. So if we're going to be intentional, then we have to sort of mold into our passion area. So I really want to make sure that there's an opportunity for people to learn more. So are there any other organizations that come to mind?
Well, I have to be honest, I did not prepare for that question.
I'm sorry.
I'm totally blanking.
Well, no,
the
education piece really stuck out to me when you said that. I was like, oh.
Yeah, well, and I tell you, there's been such a difference with COVID that prior to that, I feel like I could have answered that question, and anymore, I'm not sure what's still happening there post-COVID. Certainly any of the organizations, we talked about education. The other huge part, you cannot talk about West Virginia and not talk about that there's a problem with food insecurity, So any programs that would support healthy nutrition, that would support exercise. We live in those great mountains, and in all of those years, I mountain bike a little bit, and my family does, but in all those years, I never had one child say that they mountain biked. And you're like, what? It's like everywhere. Like, people come from other places to do this, but I just don't think they have the opportunity. So there are, in some areas of West Virginia, a couple of organizations that are starting programs like that in high schools. But again, there were none in our area, right? And so it's amazing the natural beauty and the outdoor, opportunity in West Virginia that is never taken advantage of by the families who do, but it was few and far between. I mean, I have moved to Washington, and one of the funny things is that I came here and, I considered myself somebody who hiked, and I have moved here, and in the clinic, I'll be like, okay, so what's a good hike? And they'll say, oh, there's a great 10-mile hike of this. And I'm like, okay, like 10 miles. No. Okay. So like 2, 3. Okay.
Well, I lived in the Blue Ridge Mountains too, so I totally get it. Like, you do have those shorter paths. So.
Yeah, it's a different world here. But back home, I never had anybody. There were families that would talk about it on the weekend. I think if you lived in some of the certain communities, you did. But in these smaller rural towns, they rarely talked about that. So any groups that get kids outdoors, outside, there's one I'm thinking of right now, and I'm going to think of it as soon as we get off the phone, but it gets kids on bicycles. From the time they're young, and it's a Southern West Virginia based program. But anything like that promotes health, nutrition, exercise, it is what is needed. Anything that promotes, helps with food insecurity, which is a major issue. Just like a lot of rural states, there's a lot of food deserts in the area. Not a lot of opportunity and it's not a big farming community either. And so you don't end up with, unless you're in the Eastern Panhandle, you don't end up with local farmers and people used to eating fruits and vegetables. I mean, so you really, those are major concerns with the kids.
When I was just listening to you, it just reminded me, I have 2 nieces and they live in in the rural area. So when I think about rural, like Savannah is like an hour away. And if they wanted to do a program or something in Savannah, it's a lot of work to get them there. Like, it really, it's not as easy. Like, oh, we can just run up on a school day and run to Savannah and have you in this program, wait for you, and then leave again. It just doesn't happen. And that's one of the things that really stood out to me, as even during COVID, I've been trying to get them into like virtual programs, anything that's like available, because when you're in a rural community, there's not as many nonprofits. People aren't there like trying to support and create programs in your school. It's a very different, like at least I could say in like urban, there's like always someone with a new idea, but there is absolutely, it's really, just even STEM, like STEM seems so, like I almost feel like it's like overused. Everyone's doing a STEM program, but my nieces had one program for a 3-week summer program that someone offered STEM, and they both love math and science, but they literally like aren't inundated with programs. It's really hard.
When you're in a rural area, you have fewer people who are going to have the ideas. You generally have a lower general educational level to come, to make ideas happen, or have the knowledge to how you get them off the ground, right? You have fewer businesses. I mean, like I said, in the town that I was practicing in all year, the big car dealership left, the college left, the restaurants left. Who's there to give you money for a program? And if you're in a rural area and you grew up in a rural area, you may not know it takes a really special individual to come up with those things and get creative about how you get funds for those kind of programs. And so they're few and far between.
Yeah, and it takes, I see our local pediatrician was creating those programs. So it is a special individual who does it. So
I don't know. It took a lot. It takes a village.
Well, it's and that's the thing I always think about conscious giving, is that when you're doing it and people see it, it's like, and I don't want to say it's infectious. It's just something that you have to learn. It's not, at first I used to, when I first started conscious giving, I had a lot of different ideas and all over the place. But, I really narrowed in on about, I just wanted to evangelize for people to become conscious givers. And I guess in that piece, it was more so like, I was thinking, I got to watch my mom and how, every day, how she helped other people, her philosophy on life. So I was like, I did learn how to conscious give. And so the more that people can learn in real ways, there's a lot of things out there that isn't really like real. Let me just say it's not real. But like when I hear you talk about, how you use your work, and I'm sure you never thought about it as a platform, but even like you said, a little bit of ego, but I thought, no, this is a role model in the community to encourage others. I mean, you play such a pivotal role in the community and has such a broad perspective. I guess the big question I want to close with you is that, there is so many challenges in rural America in terms of not just challenges, but then when we narrow down to health, if there was one thing, it doesn't have to be the right answer. I know we talked about education and you could talk about that again, but if there was something that was just you think that was going to improve health outcomes, and what would you say would make one of the big, or you could say more than one, you can cheat and say more than one, but what would you say would be the change that you would want to make?
Well, I feel like I already used this, but
no.
Yeah, I do. I still go back to education. I think that I just think that's the vital in all of America, to be honest, is that education and kind of teaching critical thinking and those kind of things, really. But when it comes to the lack of education that so many places have about basic things, it's not even necessarily education in a school setting, but education about mental health, education about nutrition, education about, I think that education can encompass a lot of different things. I mean, your own medical self-education, wellness education. Wellness is huge.
Yeah, or even how you advocate for yourself. I'm sure you have many times you had patients and they were like, well, I just didn't know if I should say anything or what it was.
Yep, exactly. And so I think that that's kind of, I like to talk to kids with anxiety and depression about the foundations. You have to be sleeping, you have to eat healthy, and you have to, those kind of things. And I think that there are so many moving parts to all the things that need to change. But when you tear it all down, it basically comes down to education is the one word that can have a lot of different branches, and you can take it a lot of different ways. But I think that education of the children in those areas, education of the parents about parenting, and education to teachers about how to, deal with kids who have experienced adverse childhood experiences and those kind of things. It ends up being a huge, broad topic that I bring up. I'm not narrowing it down to one specific thing. Sorry.
No. It makes a lot of sense. And from the perspective of, my big goal is for people to walk away and to say, what can I do to make this better? And you really are, if I love biking and I don't live in West Virginia, I never thought about the kid, kids don't have access to bikes. Bikes are actually really expensive.
Yes, yes.
Like, they're really, that
Yes,
is
they
not
are.
high on the priority list when your family's food insecure.
Exactly. You're absolutely right.
Yeah.
And,
Yeah.
and honestly, when you talk about bikes in West Virginia, it's not easy. A lot of these kids live up roads that don't have safe, they're 2-lane roads between 2 mountains, and nobody wants their kid riding a bike there. You get into
a number. Yeah.
A lot of different issues, but I do think that program, I think that did come to me. It's called Active West Virginia. So anyway,
okay.
Somebody can Google that and look it up. Maybe.
Yeah, no, that would be great. No, I want people to learn and to hear about, and it's always about exposures for programs that are making an impact, because, as a conscious giver, you're partnering with organizations to make an impact in the community. And Traci, you made you built a legacy, even though I know that you have transitioned and still doing amazing work and in the community that's so needed. So I think it's going to keep your mind active to have to start over again, in a sense.
It is.
You're like, new challenge.
It is. Yes.
But I love that. I love the legacy that you built in your community, which is not just, this is a big community that we're talking about, over all the children that you served. And what's so nice is, when you were talking about 19 years, I was like, you really affected a generation. So congratulations on the work that you do, and the conscious giving that you were doing in the community, and what you gave back to your hometown. It's so amazing. And I love the picture that you painted about rural America. There was a time I was like, oh gosh, I was like, this is really hard, but when you were talking, but it really did, you did it in a very uplifting way. And that's the part I really love. Like, it's very uplifting.
Thank you.
Yeah. And I don't know if there's anything that you wanted to share, you wanted to close. I just want to give you an opportunity, if there's something that we didn't cover that you wanted to.
I mean, I think that we're probably okay. I think, I think we're good.
No, this is great.
I'll start. Yeah.
Well, this is going to be on our blog and in our conscious giving everywhere where podcasts are located. But oftentimes you listen to a podcast and they're like, share this or tell them, and I really do. I'm hoping, like, through our guide, that people are able to share. And because I think this is just experiences that people don't get to hear enough about. And there are so many folks who are there's so much that needs to happen with our healthcare system, and there's so many ties that and I'm going to say education too, that really that needs to happen. But we are always appreciative of conscious givers like you making a difference. So thank you for joining me and being a part of this.
Thank you so much for having me. I appreciate it.
Yeah, thank you.